Hello, this is Dr. Arun Lakhanpal, and today I will be speaking to you about asthma. Asthma is one of the most common pulmonary diseases. It is basically a chronic inflammation of our breathing tubes, which makes our breathing tubes twitchy, which means the caliber of the airways narrows because of muscle spasm of the muscles around the tubes and due to swelling or edema of the lining of the breathing tubes in response to either an allergy or an irritation from allergens or from occupationally related dusts and fumes. Characteristically, these symptoms are episodic, that is, the spasm is precipitated by one of these stimuli and the patient feels breathless, wheezy, which has wheezing sounds in his breath. His breathing rate goes up and may feel chest tightness. This eventually settles either on its own when the stimulus is removed or with the help of medications. This is not to be confused with similar symptoms produced by an infection, which may be infective bronchitis. So the symptoms of asthma have to occur other than when there is an infection and in response to a stimulus, which may be an allergy, cold air, exercise, or even emotional stimulus. It is very important for a successful treatment of asthma to make an accurate diagnosis. Heart failure may mimic asthma. COPD, which is smoking related, may appear to be asthma, although persistent asthma may behave like COPD as well, with only minor differences in the treatment. So if you have a strong family history of asthma, which is a strong predictor of you developing the disease, and you have associated features like allergic rhinitis or irritation in the nose, sneezing, or hay fever, or if you have any tendency of allergy, whether it be skin allergy, food allergy, drug allergies, and you develop respiratory symptoms, which may be just a cough or breathlessness and wheezing and chest tightness, you must consult your doctor. Untreated asthma, which initially is episodic, can become permanent and quite disabling. Thankfully, treatment is highly successful and involves inhaled therapy, which is inhalers as a first line, and tablets for allergy, etc. Your doctor might want to do a breathing test or some allergy tests, although none of them can confirm asthma, and the diagnosis is basically clinical. The first line treatment is inhaled therapy, which initially is intermittent, but then we need to add on a steroid if your asthma is still active, which is confirmed by symptoms, that is, you get symptoms every day or have to use an inhaler at least 3 times a week, or you are woken up in the night, even if it is once a week, due to your respiratory symptoms. Once your inhaled therapy is maximized, then we go on to add oral tablets, oral anti-allergics. In another educational video on my site, I have explained the correct method of using the inhaler, and you must go through that with your physician. It's absolutely vital to use the inhaler correctly. If your symptoms are not under control, you must see your doctor to exclude other conditions that may make your symptoms worse, such as gastroesophageal reflux, postnasal drip, and also be aware that some medications like beta blockers and aspirin can precipitate narrowing of your airways or bronchospasm and make your asthma worse. You must stop smoking and lose weight, as they have been proven to improve the control of asthma. Asthma, unfortunately, cannot be completely cured if it happens in an adult, but the symptoms can be effectively controlled, so much so that you would rarely need to take treatment. Thank you very much.